A very good question is, can this procedure, RLE or cataract surgery, make my vision worse? Um, and that's a very loaded question, but a really good one. And we can break it down to two categories. Now, it's unlikely that you'll have a complication during surgery, but highly unlikely with RLE surgery. But let's suppose you had a complication, and let's suppose that complication was an infection or a retina tear or retinal detachment. These are the two things that can cause you to have vision that's worse than before you started the surgery. And those are two things that we typically go into detail talking about. I think there are many videos that I made that discuss the probabilities and risks and I've never seen a retinal detachment after surgery, but that doesn't mean that someone's not going to be my first retinal detachment. And then infection is almost it just doesn't really happen this day and age. But if you look at the data from like 20 years ago, maybe 1 in 10,000 eyes or patients. But now I don't think there's any recent data, but I'm pretty sure it's really hard to study these things when the occurrence is really low, because you need a very big statistical sample size, and I think it's just really hard to collect that data. So which suggests to me, because there's absence of data, that it's probably much lower than 1 in 10,000. Anyways, those are things that are related to complication. Any other complication during or surgery or after can be fixed, but those are the two that are hard to fix, because it's just very highly variable. It delays in treatment, what kind of infection, all of these things play into the prognosis, the final vision that's recovered. So those are the two where you can come out worse. Now let's talk about you had a great surgery, everything went well, but you feel like this isn't quite right. Well, we talked at length in other videos that you could be off target, which means the power of the lens may not be the right fit for your eye, in which case easy to fix. We can just back calculate, take out the lens, put in a new lens with the right power, do a little LASIK surgery if you choose to go that route. Essentially everything else is much easier to fix. There was a particular situation from, let's say, 8 years ago, 7 years ago, where our multifocal lenses and our advanced technology lenses had issues with contrast sensitivity. This is sort of, these lenses came out about 20 years ago, but this is like halfway to where they are now, where if you do RLE surgery on a patient who's too young with a clear lens, and you replace it with one of these multifocal lenses circa 2016 or so, there's a chance that the original native lens, your own lens, had better contrast sensitivity than the implanted lens. And that's because some of these multifocal lenses, or lenses that split light or stretch the focal point of light, can cause a slight decrease in the quality of the image. As you can imagine, if I had one single focal point, I'm putting 100% of the light going to your eye to that focal point, then you get a really crisp, nice image, as nice as it can ever be. But if I then take a multifocal lens, and now we're giving you 3 focal points, and the light has to be allocated to each of these focal points, then for any one distance you may have a little bit less contrast. So, and of course, if I decrease the amount of light going to your eye, going to a darker room, for instance, then less light to each of these focal points. But the recent lenses, and as recent as like 2 or 3 months from when I'm making this video with the PanOptix Pro, huge steps forward with light utilization. I think 8% increase over the PanOptix original. And what we see is I'm doing this lens in 31-year-olds now. I did a patient 2 weeks ago, 31, super happy, doesn't notice any decrease in contrast sensitivity. It says best vision. Well, I shouldn't say that. She said it was as good as her, wearing her best glasses before surgery, which tells me a lot. It tells me, because the glasses are single focus, it tells me that the contrast sensitivity is with the PanOptix Pro. And in this patient, I had to stack two lenses. She's a special case. So I had two lenses. Obviously, the more lenses you have in there, the less contrast. But even using two lenses stacked on top of each other, she said, incredible, as good as glasses prior to surgery. So that tells me a lot. And these companies are really good at what they do, and these scientists, they and they're constantly, I think one of the people that make these lenses told me that they're already working on the third generation of PanOptix, PanOptix Pro 2 coming out in a few years from now. But they're constantly innovating. But we're at the point where any of these multifocal lenses, I feel, is superior probably to a 45, 50-year-old's natural lens with higher light transmission. These lenses can be used very, very well with patients with prior LASIK surgery and other surgeries as well, which was, I think back in the day, 8 years ago, was kind of a no-no, because you can think that LASIK surgery causes you to have a multifocal cornea, a little decreases contrast sensitivity coming from your cornea, and then that gets less degraded even more with a multifocal lens, where you're losing contrast as well. So the two, don't pair very well. But nowadays, I think the multifocal lens almost has the same amount of light transmission as your monofocal lens, which hasn't really, there's really nothing to update with monofocal lenses, just single focus lenses. So they're still the same from 25 years ago. But now they're sort of almost neck and neck. I think theoretically they'll never be neck and neck, but once you reach a certain threshold and they're close enough, it's imperceptible, but certainly better than the natural human lens at age, And I think, and this is purely conjecture, but I think that age now is about 40 years old, where these advanced technology, multifocal lenses with higher light transmission are going to be equivalent to that of a 40-year-old. But of course we've seen that it's as good as 31-year-olds natural lenses. So gosh, I forgot what the question was. Yes, can it make my vision worse? So sorry, that's a long answer for yes. If you chose the wrong lens and it was an older generation lens, and your original natural lens was better quality, better contrast sensitivity, then what we typically advise patients to do is, if they can't tolerate and don't want to spend time to adapt to the multifocal lens, is to simply take it out. Give it a good solid 6 months to 9 months. If you still don't like it, let me remove it, and then we're going to put in a lens that doesn't split light, has better contrast sensitivity. But you have to know there's always going to be trade-offs to doing that. So a non-ringed lens with better quality of vision or contrast sensitivity is not usually going to have the same range as a multifocal lens. So then you are potentially a little bit reliant on glasses, maybe let's say for your near work. Anyways, but I think we've addressed all scenarios where the surgery can make your vision worse, but they're all, at least in this day and age, very rare. So I would say, you would come in, and you and I would both expect that after surgery your vision will be better than where you started. It may take more than one surgery, and it sometimes just does, despite best efforts. Wrong power of lens, or wrong style of lens, but we will work with you and get you into a lens that you like, and that will meet your expectations. All right, thank you.